A straightened lumbar spine is a serious misalignment, and it's often diagnosed either on an X-ray report, sometimes on an MRI, but an X-ray report in the standing position, the X-ray is a better diagnosis for a straightening of a lumbar spine. Said another way, loss of lumbar lordosis or flat back syndrome. But what exercises are good for that? I often get asked on my channel, what exercises are good for a straightened lumbar spine? So that's the topic of today's episode of Ask Dr. Walter Salubro. This is episode number. Each and every day, I'll upload a video on my channel. Be sure to watch it, subscribe right now so you don't miss out on these daily videos. And what I'll do is I'll take an actual question, a question from the comment section of my videos, a question that could be on many people's minds, maybe on your mind, and I'll answer it in a video format, in a short video format. Okay, so this is something I'm committing to each and every day for as long as I get interest and engagement continuing. So please let me know in the comments what your interests are, what your questions are, what your comments are, and your thoughts. And who knows, maybe your question will be next on the next episode. So this is the question by IK. So the person's YouTube handle is IK, and this is what IK says. Hi, Walter. Any specific exercises for straightened spine with disc bulge between L4 and L5? Great question, because there's two things that are being addressed in there. One is a straightened spine, and of course, because IK mentions L4, L5, I'm assuming that's lumbar spine, straightened lumbar spine. So, and then of course, disc bulge. Okay, so a straightened lumbar spine can cause disc bulge injuries. So that's why it's a very important thing that needs to be addressed. Plus, of course, it can stress the nerves in the lower lumbar region, the nerves that go into the sacrum, cause all sorts of problems, not just low back pain, but the disc degeneration, disc bulge, and maybe even leg pain. So, some things can be done at home for exercises. I actually have other videos on my channel, which I'll put in the description below, that talk about straightening the lumbar spine. I have several videos. So some of the home exercises that can target straightened lumbar spine are, number one, seated pelvic tilt in the anterior position, the forward position. So when you're doing pelvic tilt, typically you go forward and backwards, or anterior pelvic tilt and posterior pelvic tilt. But if there's a straightening of the lumbar spine, you want to increase the lordosis there. So by doing a forward pelvic tilt in the seated position, that would help, okay? Also, it can be done in the standing position or in the lying down supine position. But I like the seated position because you can really arch your back and get that lordosis in there. So I would avoid the posterior pelvic tilt, and I would focus on the anterior pelvic tilt. Every day, get a good 30 reps in there, okay? Another type of exercise to promote lumbar extension would be straightforward lumbar extension, like a Mackenzie extension, either prone on your elbows or full out arms stretched out. Again, that can help promote a lordosis in there or relieve pressure in the lower lumbar spine and the lower discs at L4 and L5. You can also do Superman. Superman does extensions also, so where you're extending your arms up in the air, legs back are off the ground, and you get an arching in your lower lumbar spine. That's also very useful as well, okay? So those are some tips that will actually target the lumbar lordosis and will help strengthen those muscles, possibly even relieve some pain associated with irritation on the discs or the nerves or the joints in the lower lumbar spine because of a straightened lumbar spine. In addition, okay, those are supportive exercises. In addition, a straightened lumbar spine needs to be targeted from a corrective structural perspective, and that's where corrective chiropractic care comes in. And corrective chiropractic care, technique like chiropractic biophysics, of which I'm trained and certified in, we apply specific tractioning setups in our office, also send patients home with a specific traction setup that will actually help induce a lumbar lordosis or increase the curvature in the lower lumbar spine. So we do lumbar extension traction. So we'll use equipment in our office such as a Deneroll table or a universal traction station. And again, I'll put these videos in my description below so you can see some of the demonstrations that I talk about. I use a spine model. You'll see some actual demonstrations on the equipment as well. So some form of traction will be helpful. So the exercises are good for support, for warming up the muscles, strengthening the muscles, warming up the ligaments. But then you need to do some kind of sustained traction in the sagittal plane to get the ligaments to actually go into a deformation and reset into the better position, okay? And of course, it's going to be done over several weeks and months under the supervision of a corrective care chiropractor. We also send people home with the lumbar Deneral. You'll see that in the video below. Make sure you click on that to see some ideas of how to use that. And that's a home traction unit and traction spinal orthotic that we give to patients to help create a lordosis in their lumbar spine, specifically targeting the lower lumbar spine, getting extension in there for the purpose of correcting and improving the straightened lumbar spine. So those are some ideas. A great question by IK, and a good time to review it on my channel. And again, if you have a question, leave it in the comments below right now. If you have any thoughts, please add them there as well. Let me know if you like this video series that I'm doing every day, and who knows, your question could be next as well, okay? And if you missed the actual past episodes, just go right here. Right there, you see the video up there, okay? Go right there on the playlist and catch all of the past episodes. You can binge watch them, choose your favorite episode, and like this, you don't miss out on the past episodes.